Good morning. I'm Philip Duldulao. I'll be giving this next session on the surgical checklist. Just going back a little bit on the prior session regarding surgical outcomes and quality. I think we had a good panel discussion earlier, so this is just one aspect of surgical quality that I want to discuss. Disclosures, none. Adverse events in surgery are a worldwide problem. We do about 250 million major operations. It's higher than the number of childbirths worldwide, but the mortality due to surgery is actually 10 to 100 times higher than birth complications. About 50 to 67% of hospital adverse events are attributed to adverse events from surgical care, and more than half of these are preventable according to most studies. Risk of perioperative death is elevated in inpatient surgery, and the risk of major complications obviously result in over 164 million disability-adjusted life years to the society. So what are the types of errors that the surgeons are performing? This is an analysis of errors at a teaching hospital actually in Boston. You'll see this name quite a lot in my presentation here, Dr. Gawande, but basically he interviewed about 38 surgeons regarding all the adverse events that occurred within these three teaching hospitals. And these were 146 adverse events. And basically these were all cases that were brought up from the weekly M&Ms and also self-reported incidents. And he basically dissected these adverse events down as to where did these errors occur. Most of them, as you can see, occur within the operating room, a huge majority. And a majority of these are in non-emergent cases, which is surprising to me. You'd think a lot more mistakes may happen in an emergency, but in all actuality, a majority of these occur in non-emergent cases. And obviously most of these, since their operative complications do occur in the errors or adverse event occur in the intraoperative management of these patients. Furthermore, a third of these incidents resulted in permanent severe disability. But what were these types of injuries in the operations? And majority of these injuries occurred from injuries to, it was the appropriate operation, but they were injuries to basically surrounding structures like the bladder, the ureter, the bowel, and certain operations, as well as complications related to bleeding. Another study also performed by this is looking more into that, into the errors that occur within these centers. Approximately half of these, if you look at it more closely, half of these adverse events were associated with